and monophasic you view up to 360 joules. Here, okay, this is all about the defibrillator. And before going to this, very important is 5H and 5T, which are the reversible cause of cardiac arrest. Reversible cardiac, how many times you have to do the CPR? It is 100 to 120 per minute, and the depth is 5 to 6 centimeters in adults. And the another important question which was asked in the INI-CET, the CPR 2020 guidelines came on October 21st of 2020, and then the November second week examination of INI-CET, there was a question, the respiratory rate. You earlier used to say like 6 to 10, 10 to 12 per minute. Now they standardized it is 10 per minute in adults, 12 per minute in adults, 12 per minute in adults. And in infants, it is 20 to 30 per minute. This was the question which was asked. Infants, 20 to 30 per minute. This was the question asked. In children and infants, 20 to 30 per minute. Then 5H and 5T. What are 5H and 5T? Hypoxia, hypovolemia, hypothermia. Come on, guys. H+ion acidosis, hypo or hyperkalemia. 5T are toxins, tension pneumothorax, cardiac tamponade, thrombus, both coronary thrombus, pulmonary thrombus. Very important. 5H are hypoxia, hypovolemia, hypothermia, H+ion acidosis, hypo or hyperkalemia. 5T are toxins, tension pneumothorax, cardiac tamponade, and thrombus. It might be coronary thrombus or pulmonary thrombus. This 5H and 5T are very, very, very important, which are the reversible causes of cardiac arrest, which you must remember. Okay, this all and another important change which happened in 2020 guidelines is the perimortems there in section. Earlier they used to say for 4 minutes. Now they made it from 4 minutes to 5 minutes. This is also an important thing you want to remember. Perimortems, yes. Okay, from 4 minutes to 5 minutes. Then very, very, very important. This question in the last 5 INI-CET examinations starting from 2020 November, 3 times this question was asked based on the IV cannulas. And again, all these questions were asked 2 times from 18 gauge and 2 times from 20 gauge and 1 time from 18 gauge, and 2 times regarding the color and 1 time regarding the flow. So the colors, this one thing which you can't afford to forget. So the 14 color is 14 gauge cannula is orange in color, 16 gauge is gray in color, 18 gauge is green in color, 20 gauge is pink in color, 22 gauge is blue in color, 24 in yellow, 26 gauge in violet. So 14 orange, 16 gray, 18 green, 20 pink, 22 blue, 24 yellow, 26 violet. And the maximum flow, see, there's minor variations, but maximum flow for 14 gauge is 270, 16 gauge 180, 18 gauge 90, 20 gauge 60, 22 gauge 45, 24 gauge 24, 26 gauge 12. In the examination, it was asked as 93. So if the one which is nearest to that, go for that. Don't keep thinking that it was said 90 in the class, so it has to be only 90. So the closest whatever is there, you go for that. Again, spend 1 minute on this. Very, very, very important. 14 gauge orange. 14 gauge cannula is orange in color, and the maximum flow is 270 ml per minute. 16 gauge cannula is gray in color, 180 ml per minute. 18 gauge cannula green in color, 90 ml per minute. 20 gauge cannula pink in color, 60 ml per minute. 22 gauge cannula blue in color, 45 ml per minute. 24 gauge cannula yellow in color, 24 ml per minute. 26 gauge cannula violet in color, 12 ml per minute. This is very, very, very important. Spend 30 seconds seeing this and these colors. Very, very important. There is another one more, like where 17 gauge cannula is there, which is white in color, but we are not using nowadays commonly. So just spend 30 seconds seeing this. Usually 16 gauge cannula you use in polytraumas. Another 15 seconds. Make sure if this question comes, you won't miss this. Okay, done. Then this is a non-invasive ventilation mask or NIV mask. It can be used for both type 1 and type 2 respiratory failure, but predominantly used in type 2 respiratory failure. It is most commonly used in obstructive sleep apnea cases in chronic patients and in conditions of acute exacerbation of asthma and COPD. These conditions you use. Okay, OSA and acute exacerbation of asthma and COPD. Then this is a mechanical ventilator used for invasive ventilation and non-invasive ventilation. This is a simple thing which you can remember. This is a ventilator normal which we use. And this lignocaine formulations. See, the lignocaine is available in various formulations. This is just to identify. 0.5% use it for intravenous regional anesthesia, that is a BS block, which we discussed. 1 to 2% is used for epidural and for peripheral nerve blocks. 2% jelly is used for urethral procedures like urethral cannulations, like urethral cannulations like Foley's catheter insertion. And 5% heavy, not normal, 5% heavy is used for spinal anesthesia. 4% and 10% is used for topical or surface anesthesia. So 0.5% is very concentrated in IVRA, intravenous regional anesthesia. 1 to 2% for epidural and peripheral nerve blocks. 2% jelly for urethral procedures. 5% heavy for spinal anesthesia, 4% and 10% for topical and surface anesthesia. And EMLA is eutectic mixture of local anesthesia, which is a mixture of lignocaine 2.5% and prilocaine 2.5%. Use it for IV cannulation in children, and it is slow in onset, 30 to 45 minutes, and it is contraindicated in broken skin. Okay, it is used for IV cannulation in children, and it is slow onset for 30 to 45 minutes, and it is contraindicated in broken skin. Got it? So one important thing is here, if used in broken skin, because it contains the prilocaine, it may cause methemoglobinemia. Then this is very, 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 very important. This is 20% intralipid formulation. Used in local anesthetic systemic toxicity. This 20% intralipid formulation is used in last local anesthetic systemic toxicity, where I said like most common with the bupivacaine. Bupivacaine is a drug which is most cardiotoxic drug. Bupivacaine is the most cardiotoxic drug, and if the cardiotoxicity occurs due to bupivacaine, usually it causes ventricular arrhythmias, where you treat with amiodarone, bretylium, and procainamide. And then if there's a cardiac toxicity which happens, then the drug of choice is this 20% intralipid formulation. And remember that the cardiac arrest which occurs due to this intralipid due to this bupivacaine toxicity is very difficult to revive. Okay, this is what I said. This local anesthetic systemic toxicity, most common seen with bupivacaine, highly cardiotoxic. Most common arrhythmias are ventricular arrhythmias. Cardiac arrest due to bupivacaine toxicity is very difficult to revive, and the treatment is with 20% intralipid formulation. Very, very, very important. Then, as discussed, this strain of 4 phase 1, you see the constant and diminished response seen with succinylcholine normal doses 0.5 to 1 milligram per kg. Phase 2 is seen fade phenomena, succinylcholine with high doses more than 5 to 10 milligrams per kg, and it is seen in non-depolarizing muscle relaxants. Then, as discussed, Sugamadex, this is a structure where it has 8 gamma cyclodextrin, and highest affinity is for rocuronium, highest rocuronium followed by vecuronium and then pancuronium. Then, if you get this image, what is the inhalation agent which causes this centrilobular necrosis? It is due to halothane, which causes halothane hepatitis. It is most commonly seen in 40 to 50 age group females with a family history, and the mortality is up to 75 to 80%. Then isoflurane is inhalation agent of choice. It is agent of choice for cardiac surgeries, neurosurgeries. Isoflurane is a purple color vaporizer. MAC is one. Just remember, it is the inhalation agent of choice for cardiac surgeries, neurosurgeries, pheochromocytoma surgeries, and controlled hypotensive surgeries. Then sevoflurane, the MAC is 2, stored in yellow color vaporizers, inhalation agent of choice for induction in children and for daycare surgeries in children, and it is sweet smelling. That is why it is used in children. Then desflurane, it has MAC of 6, it is pungent, irritable, and it is an agent of choice for daycare surgery in adults, bariatric surgeries, and geriatric surgeries because it has less blood gas partition coefficient of 0.42, rapid induction and recovery. So that is why it is used for daycare surgeries, bariatric surgeries, obese surgeries, and also in geriatric surgeries, because immediately after the surgery, the patient comes out of this. Then a couple of points to remember. Thiopentone, it is used in neurosurgeries, is contraindicated in asthma, COPD, and acute intermittent porphyria, variegate porphyria, congestive heart failure, and those patients with beta blockers. And propofol, important points to remember, it is the agent of choice for, it is IV induction agent of choice for the patient for daycare surgeries, LMA insertion, ICU sedation, and for total intravenous anesthesia, along with remifentanil or fentanyl group, ICU sedation, LMA insertion, because it has maximal inhibition of airway reflexes. In propofol infusion syndrome, if you use more than 4 milligrams per kg per hour for more than 48 hours, it causes propofol infusion syndrome, where it may cause metabolic acidosis, skeletal myopathy, and acute cardiomyopathy. And it has a characteristic green color urine due to the presence of phenols. Then coming to ketamine, ketamine causes dissociative anesthesia. It is the only IV induction agent which has analgesic property. It causes hypertension and tachycardia and increased ICP. So that is why it is contraindicated in cardiac surgeries and neurosurgeries. And very, very, very important, it is used for right to left shunts like tetralogy of Fallot, because you need increased afterload in these cases. And it is also used in asthma patients, burns patients, for dressings, and indication for induction in full stomach patients and in shock patients. And then etomidate is the drug which is most cardiostable, used for cardiac surgeries, and but the side effects of etomidate are very, very important. It's the IV induction agent which causes maximum pain, nausea, vomiting, thrombophlebitis, hiccups, myoclonus, vitamin C deficiency, and adrenocortical suppression. And there's a dexmedetomidine which is becoming popular. It is selective alpha-2 adrenergic agonist. Selective alpha-2 adrenergic agonist, used for ICU sedation, and it helps for the conscious sedation. Conscious sedation is very important. So this is all about the most important image-based questions and the potential questions which you can expect in the INI-CET examination. Considering, if you see, you can't forget about the capnography. I'll tell you, like, you can't go to examination without going to capnography, IV cannulas. Okay, very, very, very important. Capnography, IV cannulas, and then another important BLS, ACLS guidelines. These three questions will fetch you 3, and another is bispectral index, BIS. So another is airway equipment. Capnography, IV cannulas, airway equipment, and oxygen delivery devices, BLS, ACLS, and bispectral index. Among these 5 topics, like, you will get like 4 to 5 questions very easily. So this is very, very important. This is all what we want to discuss in this 1 hour. Now you have a couple of minutes to ask the questions. Couple of minutes to ask the question. Any questions? If not, again, okay. Then again, see you tomorrow with the INI-CET orientation session, how we can take it forward for the next 10-12 days of preparation, how you can streamline your INI-CET. Tomorrow afternoon, you'll get a message regarding when will the session be, and keep reading. All the very best. Have a great day, guys.